Hello, I'm Brenda Asterino and welcome to White Rose, Expressions of Free Speech. This is a program about issues close to the heart and in line with our political times. White Rose is named in memory of Sophie Scholl, who was an underground resistance participant during World War II in Germany. She died fighting for free speech. Well, I have to ask, in looking and seeing for the first time many things that I didn't seem to have been aware of before, where have I been? Work, family, and dealing with the personal issues in life we all have to experience. Why didn't I see? At age 82, my mother had a stroke during a surgery and came to live with me. She, always having been a thinker, a doer, a survivor, an organizer of information and philosophy, a dancer, a lover of music, she was someone worth knowing and remembering. She did not deserve what happened to her in her final months of life, and her family did not deserve to bear such angst. Hello, my name is Brenda Asterino, and I'm here to speak to the needs of the most vulnerable elderly, especially those most vulnerable elderly in nursing homes and hospitals. I'm here to wonder if there is not a major issue to be incorporated into our health care reform. I think this should be considered. It definitely involves transparency and oversight. The United States of America is 36th in the world ranking regarding health care, according to members of our own Congress. That means that 35 countries do better than we do with providing and promoting a healthy system and access to healthy systems of medical and preventive care for their citizens. It also seems to come down to what are our values? Do we owe anything to those folks who spent their lives helping our country to become stronger, and because they got old, now have nothing to protect their well-being and final days? Some of my relatives think that they can prevent bad nursing home care by having more money to buy better care. I don't personally think so. I think that we can spend $50,000 a year on bad care, or we can spend $100,000 a year on bad care. I believe it is the system, and perhaps also our lack of valuing the process of growing old. Maybe we have a fear of dying and don't want to look at how things really are. Maybe we haven't looked at what has been happening in our family values for too long of a time. It seems to me our churches have also been ignoring the civil and personal events that have been encroaching on our issues of family and the continuity of life and our lineage of family and the empowerment it gives. It takes power from us to demean and deny the needs of our elderly and cast them off. I hope you all will discuss these things and determine what you can do about it, at least in your own families. I thought I could keep my mother in my home. That was not possible after 6+ years due to her deteriorating condition and my deteriorating health from the stress of trying to care for her 24 hours a day. There are whole other issues here for another time. But let me address some specific things. Some states have more support to keep their elderly in the family home. Many states do not. You cannot assume that because your state offers extra assistance to keep people in their homes longer or to keep people with their families through their dying process, that it occurs in all states. It doesn't. If your parent is 2 states away, they may not have the same advantages of those who are living in the same state you're in. And this applies to when they go into care centers also. There are gross differences between states. Because I now live in Washington, I cannot get copies of my mother's medical records from when we both lived in Ohio. I was her power of attorney and still cannot get the records. No attorney will help me because there is no income in it for them if it goes to court. According to one attorney in Ohio, the elderly have no economic value, and therefore there is no advantage to take any of this to court. I'm here to speak for those who, because of their age and condition, have lost their voices in this country and seem to have also lost some or all of their civil rights. I am here because we are a community of humanity, or we should be. Instead, places that care for people seem to be corporate communities with corporate values instead of the values of a human community. The issues I address will be those from experience as a family member in medical situations in nursing homes and hospitals. I was the power of attorney, and the issues and concerns I address will be from that perspective, plus my opinion of this and the shared experiences of others. I will try to let you know experience from fact and from opinion. Now let's speak to some basics. Nursing homes are not run by doctors. They are run by corporations. Before 1965, they were owned and run by mom and pop operations usually. Many of them were owned or supervised by community governments or councils. In 1965, the federal government decided to supply Medicaid and Medicare funding with certain criteria for keeping or using these funds. That is when the for-profit corporations started setting up nursing homes. The corporate nursing home industry was born as Medicare and Medicaid and began providing the funding for places that took in the poor, the elderly, and those who were too ill to live on their own. They were then licensed and regulated, which gradually pushed out those who couldn't compete or couldn't get licensed fast enough. So in 1987, Congress passed a law that required nursing homes to be licensed, meet basic standards of care, and be inspected. The nursing home staff, as well as the doctor and the maintenance people, are employees of the corporation. Doctors are invited to participate, or they are disinvited. Contracts are not renewed. Corporations and companies work for profit first. And when you need a nursing home for yourself or a loved one, you need one usually immediately. It is a crisis situation, and nursing homes are not like hotels or spas. If you don't like one, you can't automatically move out of it and into another. So sometimes you have to use the one you wouldn't choose and hope to move to one better later on. This isn't so bad if you have a voice and you're heard about your needs and your concerns. Many agencies and people who spend time in nursing homes feel that many are still not in compliance with basic standards. According to Medicaid statistics, close to 30% of nursing homes nationwide are either out of or barely temporarily in compliance. There are good nursing homes, good staff, and well-intentioned nursing home owners. So what's the problem with up to 30% being out of compliance at any one time? Is it the system? Is it the funding? Is it the lack of public attention and public connection to their elders? Let's explore this a little bit. There are good things happening in hospitals and nursing homes. There are people who are trying to make positive changes. Dennis Quaid is a well-known movie star name. Recently, he and his wife had a near tragedy when their newborn twins were given 1,000 times the amount of heparins they were supposed to have been given. That means they were bleeding out of every orifice of their bodies and were near death. Babies die from this mistake. It is not an unheard of nor an uncommon thing to happen. Dennis Quaid, perhaps because of his movie star status, gained attention to this problem and of what happens when people are given wrong and lethal medications, as well as the amount of times this happens to newborn babies. Some statistics say that up to 198,000 people die a year from mismedications in the United States of America. This is considered a low number. Cedars-Sinai Hospital in California is now using barcodes to deal with medications. This has reduced mistakes to 0. I hope it is being applied to nursing homes as well, but I doubt it because it costs a lot of money to do this. This brings up documentation and the importance of proper documentation in nursing homes. This is also an area that shows the importance of family or friend of the resident involvement. First, let's deal with the importance of diagnosis documentation from the point of view of what the diagnosis means. What does it mean if a person is labeled with dementia? Is it vascular dementia? What stage is it? Is it Alzheimer's? Well, dementia and Alzheimer's is not always the same thing, and it usually isn't. And certainly vascular dementia is not exactly the same path as Alzheimer's. However, they are all cognitively deteriorating conditions. My concern is that there seems to be no national definition of even the stages of dementia. So how can different nursing homes or hospitals and nursing homes communicate on exactly where the person is in their progress of the disease? And how can the staff communicate with the family on the status of the condition of the person as they go through the stagings of the disease, dementia or Alzheimer's? How can aides be informed as to how to act and respond to people with dementia if no one knows exactly where the person is in the process? Communication is definitely a problem in nursing homes. It is a problem not just with dementia or the definition of dementia, but generally between staff and residents and between staff and their families. It is a problem between shifts of nurses and between the aides that are coming on and going off shifts, and between aides and nurses. It is a problem between care agencies and other agencies. There are also differences in how different medical disciplines or orientations evaluate cognitive conditions. A psychiatrist may not evaluate a person the same way a neuropsychologist does. Also, their approaches to dealing with the disease or the condition process is different. And sometimes it is that one deals with the disease and the other deals with the person. Another area of communication that needs to be monitored differently or cared for better involves the personal medical records of the individual. The personal medical records should be sacrosanct, and this is an area that needs more oversight. My mother was in 4 nursing homes, and all 4 added diagnoses that were not hers and not given to her by a doctor. and many subtracted diagnoses that needed to be in her records. In one nursing home, a person across the hall came in the same week my mother did to the nursing home. There were some very slight similarities in their names, very slight. My mother ended up with the other woman's diagnoses added to my mother's chart. Oh dear, if I hadn't checked routinely for such things, she might have been given medication she didn't need, or prevented from having something that would have helped her given because they thought she had another problem that would have contraindicated that medication. She would have been observed as being or reacting to things very differently because their perspective of her would have been, and their expectations of her would have been different because they would have seen her through the eyes of that diagnosis that she did not have. Her survival might have changed. The survival of her condition and how that condition or that new symptom that came up, all of those situations would have been affected by their difference in perspective. By the third nursing home, I was checking at least every other month for her diagnoses, and it was important to have access to the records from her medical and her eye doctor that attended her before going into nursing homes, so that I could prove the facts of her medical status. I also found it important to check her medication list every month. Even though family is supposed to be told when medications change and when antibiotics are started, stopped, etc., this was never consistently done in 3 out of 4 nursing homes. Some regular medical doctors or internal medicine doctors gave antipsychotics to people. I have been unable to obtain exact definitions, but I believe that OBRA 87, which is the federal law passed in 1987, says that this cannot happen without a span of time of specific criteria happening and a specific span of time of observation. In a hospital, I saw paperwork where a person was according to the new psychiatric diagnosis definitions, seeing and talking to angels is a dissociative disorder and not a psychosis. Anyway, this is another point to ponder, isn't it? In our family, we all believe in angels. Another area of documentation is the death certificate. My mother's death certificate was somewhat wrong. The space of time that defined her illnesses were wrong. I made sure both of these things were changed on the death certificate. Here is why. I called the Center for Disease Control. I asked if research is done based on death certificate information that gives statistics on diseases. Like, are they used to determine how many people died of certain diseases as defined a certain way? I told that this was true and that this sometimes was how information was gathered. I know lots of people who tell me that their parents or spouses or loved ones have misinformation on their death certificates. How much research is being done based on death certificates that have misinformation? I called the Bureau of Statistics in 2 states and asked the same questions. Do you know that many death certificates are filed incorrectly with incorrect information? How can you give information for research if the information may be faulty? I was told that this was taken into account. Now, this makes me laugh. How can they possibly know if the death certificates are 20% or 50% full of misinformation. And if the time that is given, the time spans for the diseases are also wrong, they won't know what initiated the condition or the disease in many cases. So that complicates the misinformation. It skews the results and the facts of the research. Where do we go from here? The most important thing right now seems to be to standardize what they are talking about so that communication is better and the individual is protected from mistakes as part of the caring for those people. We need some national agreements on diagnosis definitions and procedures. This would also affect how death certificates are filled out. There needs to be oversight that protects people from mismedications, misdiagnoses, inappropriate reporting on medical records, and about information being misused. I think this would happen if our systems were set up as people-centered instead of medically centered. Treating people and treating diseases are not always the same thing. People cannot be seen as things or diseases to be put into a time schedule. If they are first seen as people before they are seen as a disease, the conditions in which they live will be very different. To have licensed social workers and therapists that are not paid for by the nursing homes, but are responsible to the community for the welfare of the residents, makes a separate path from the medical-only line of care and control. We're whole people, we're not diseases, and medical attention alone is not enough for people in nursing homes. These and other issues involving the oversight in hospitals and nursing homes will be discussed in succeeding programs. Some things for you to watch for, evaluate, and discuss are what is happening in Congress with both the health care reform and other issues that are related. The Senate Health, Education, and Labor Pension Committee has worked on a bill which includes Senator Kennedy's Class Act, and that is Senate Bill 698. There is also Reaching Elders Assessment and Chronic Care Management and Coordination Act, which is Senate Bill 1009. Realigning Care, Senate Bill 1004. The Medicare Care Transition Act, Senate Bill 1009. Project 2020, Building on the Promise of Home and Community-Based Services Act, which would be wonderful if more people can be kept in their homes and usually proves to be less expensive than nursing home care. Senate Bill 1257. Now you can find out more about these bills and acts by going to the National Council of Aging website, www.ncoa.org. I am not promoting the National Council of Aging. The local councils of aging have been less than honest with me in 2 states on the oversight and the efforts of government agencies to see that our elderly are properly receiving the standard of care that has been outlined by Medicaid. But they do provide good information on their website about what is being done. I do believe that they need to focus more on helping the most frail and vulnerable elderly, those without voices. Please remember that monies have been reduced by Congress for things like dental for our vulnerable elderly in nursing homes. people do die of septic infections from improperly cared for teeth, and it's not a pleasant way to die. The National Council on Aging is promoting healthcare reform to include more chronic care strategies. Please remember that this council has been around for a while, and they are good with identifying care needs in the community, but mostly with those people who are still able to use their voices. As community members, we still need to be watchdogs. The silver tsunami, we baby boomers, are the ones to keep our eyes open and our voices active. Because the generation after us are too busy finding ways to provide medical coverage for their families and working multiple jobs to keep body and soul together for their families. These are not easy times. They are exciting and can be exciting if we see them as an opportunity to make change and make things happen to better improve our society and our communities. Let's make a better world for our future generations' survival. Let's make the future full of greater possibilities, and let's make our voices heard. One avenue is through the forums used for story collection for the Organizing for America group. They are doing this to let senators and congressmen know more about real problems that real people are experiencing in our national community. I hope you make your voices heard, and thank you for being with me today on White Rose and In My Opinion.